On yesterday, just a week before Thanksgiving, a young mother was talking about her struggles in trying to get emergency services for her son. She made the phone calls and tried to get emergency services because she was on a crisis mode at the moment, and she was a little disappointed by the type of information that she was receiving. Although we've made a lot of improvements across to try to improve that level of communications between someone calling in to 911 emergency services, there's still some room of improvement. Her son ended up getting incarcerated because she just couldn't get the answers that she needed in time while she was in a crisis. We've all heard the statistics. There's 1 in 5 persons who live with a mental health condition. Across the United States, that's 27 million people who go untreated with a mental health condition. One of our local jails had recently did an intake of 332 inmates who had completed a full behavior health administration. What's interesting, 14% of that 332 were homeless upon entering jail. 62 had been previously treated for behavioral health disorders, and 50% had mood disorders. There were several other categories that were evaluated, but we found that those 3 statistics were very daunting. One of the things that we're doing in NAMI Coastal Virginia is advocating for better services for mental health persons. One of the things that we're looking for is affordable housing. People with mental health conditions need a place to stay just like anyone else. But what happens is it takes sometimes 12 months or even 10 years to get a level of housing together. That's an area that we really want our state legislators to focus on and try to resolve that issue. One of the other thing is our mental health workforce. The pandemic has put a strain on a lot of health workers. Mental health workers have gotten even more strain, and there's a overall nationwide shortage on that. We're looking at ways to try to improve that, to provide some incentives to get people to want to come and work in the mental health field so we can help close that further gap in services. And then lastly, if we don't get those first 2 areas right, we're going to have a lot more people on the street. They'll be homeless. They may be subject to crime. And what we want to prevent is having our local jails from becoming mental health hospitals. Just like the statistics I provided earlier today, there are jail diversion programs that we're working to try to provide some services for members exiting jail, including medication management, some other types of services. So we would like for you to help us advocate. Reach out to your local legislators, write them a letter, send them an email, pick up the phone, tell them to support affordable housing to help increase our mental health workforce and to keep the jails from becoming mental health hospitals. If you help us with that, we could all save a life and prevent someone from losing their lives to suicide. Thank you.